A very good afternoon and a warm welcome to all of our viewers. On behalf of Human Biological Institute and Fearless Against Rabies, Fearless Against Rabies is an initiative by Human Biological Institute to educate about rabies and to reduce the incidence of disease. It's my pleasure to take this opportunity and share about Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. The One Health Initiative talks about the optimum health of animals, people, and the environment. Indian Immunological Limited was established by National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunological Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. The facility is one of its kind in India to have rolled out first virocell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines, and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and present in around 60 countries. We are three state-of-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinical proven wellness products and infertility ranges of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand anti-rabies vaccine Abhayarab, and with this we have taken significant step to reduce the plastic burden by 160 tons per annum. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in the corporate social responsibility and has taken up various projects. One such project is the adoption of government school. Indian Immunological Limited has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Mill program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indieimmune.com. You can also contact us on our toll-free number 1800-313-999977. You can also follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. You can also go through our unique initiative on the fight against rabies at www.fearlessagainstrabies.com and everything want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us today on the day of National Vaccination Day. Each year on March 16, the National Vaccination Day, officially known as National Immunization Day, is commemorated to emphasize the significance of vaccination to whole country. and appreciate hard work of medical fraternity to ensure the day is all about sharing the message that vaccination save lives and is important even today. Well, in today's session, we are going to learn about the topic the tetanus can be fatal. People often call tetanus lockjaw because one of the most common signs of this infection is tightening of jaw muscles. To enlighten us about this topic, we have a very special guest with us today. Please welcome Dr. Ramakrishna. Dr. Ramakrishna is endoscopist, consultant, and laparoscopic surgeon. Dr. Ramakrishna started first upper gastrointestinal endoscopy center in Bhadravati in 1995. Even today, this is the only endoscopy center in Bhadravati. He has done more than 9,000 surgical procedures. And for society, he has conducted several free medical camps in the surrounding villages in association with local social organization. He has served Karnataka State Chapter of Association of Surgeons of India as executive committee member for 2 years. A very warm welcome, Dr. Ramakrishna, on Fairless Against Rabies platform.
Thank you, ma'am.
Doctor, before we start our discussion for today, I would request you to please let our viewers know that what is the overview of what is tetanus.
Tetanus is a bacteriological infectious disease. It's caused by an anaerobic bacilli. We call gram-positive bacilli it is, and it causes infection when the spores of this Clostridium tetani, they enter the body. They get converted into bacilli, and that bacilli will produce the toxins. This toxin is called tetanospasmin, means it has got the capacity to cause spasms of all the skeletal muscles. So this tetanus toxin is the one responsible for all the clinical manifestation. The problem is the spores of this tetanus, Clostridium tetani bacilli. It is ubiquitous. It is there everywhere, right from manure, soil, even the gut of human beings and animals, even saliva. So any injury will produce means carries the risk of this tetanus, whether it is human or animal bites or it is open injury with a iron piece or even stone, thorn, everywhere, whatever. So injury caused by any means can produce tetanus. That risk is there. That is the importance, and it is quite often fatal disease also. Way back in 1980s, we used to have a lot of tetanus cases. When I was doing MBBS and MS, we used to see cases. Nowadays, we are not seeing many because of the vaccination. Vaccination is very, very effective, and tetanus toxoid is the vaccine we use, and it is more than 99% effective in preventing this tetanus.
Oh, thank you, doctor. Doctor, are there any different forms of tetanus?
Yeah, basically we classify them into four broad categories. One is local. Local tetanus is somewhat milder form, means only a localized group of muscles they get involved. They you will have spasm only there, and later as the disease progresses, it can get converted into generalized form. In generalized form, almost all muscles of the body they get involved. It will go into spasms. See, initially, as an initial manifestation, the only facial muscles will get involved. You may get minor twitches, or only one lower limb or only upper limb is involved, like that. In general, the whole body, everywhere, all the muscles will go into painful, severe spasm. Sometimes it is so severe that even the vertebral body bone, it gets fractured. It is so severe. Body will go into arching. We call it opisthetonus. Those problems will be there. This is the generalized tetanus. The other special form of tetanus is a cephalic tetanus. Here, instead of spasm, there will be flaccid paralysis. Most of the cephalic means head. So in the head muscles, whenever we get infection in the head region, head and neck region, maybe it's an infection in the ear or maybe on the face, these patient they will develop, and one or two cranial nerves will get involved. It may be one or more than one also. Most common is the facial nerve. Facial nerve supplies this part, like, so that part will go into paralysis, and some part may also get spasm. So the other cranial nerves like ninth pharyngeal nerve, eighth pharyngeal, those nerves also get involved. So patient will get dysphagia, means difficulty in swallowing. That is because the pharyngeal muscles, they are involved in that. The nerve supplying these pharyngeal muscles, they get paralyzed, and patient will be having difficulty in swallowing. The typical feature is the incubation period is short. In generally, we take it as around 7 to 14 days, the incubation period. But in cephalic tetanus, incubation is very short. It may be even 1 or 2 days. Means after exposure to the spores, within 1 day or 2 days, patient will start developing symptoms. This is cephalic tetanus. The other is the neonatal tetanus. Here also the incubation period is very short. The soon after the birth, first 2 days baby will be all right. It will be suckling normally. It will be active. All those things will be there. From third day onwards, it will start developing symptoms. It will stop suckling and may throw convulsions. So this type of presentation is possible up to 28 days. Between third day to 28th day, if tetanus occurs, we call it neonatal tetanus. These are the four broad categories.
Uh, Doctor, you also thank you, doctor. You also mentioned about the Colistrium tetani, also somewhat unique among the bacteria. It is not communicable. So, doctor, what kind of injury might allow tetanus to enter into the body? So, what would be actually the route to enter into the body?
Yeah, most of the time it is not the bacteria, but the spores of the bacteria.
Okay.
Means any injury, for example, a deep cut injury with a iron rod, penetrating injury, or even superficial injuries also can produce. Usually, when trauma, maybe road traffic accidents, this type of trauma will have a lot of devitalized tissue. Devitalized means it's dead tissue. It lacks blood supply. Their anaerobic conditions are very ideal. So these patients will develop the spores of the Clostridium tetani. They go and contaminate there. And I already told you these spores are ubiquitous. It is there everywhere. It is impossible to eradicate them. Even in the through the wind also it can come, through this manure or soil or rust, anything it may be there. So that will get into the body through the injuries. It may be human or animal bites also many times. So when spores get entry into the body, it stays there, starts propagating. Means the spores become bacilli. That is the Clostridium tetanus, Clostridium tetani bacteria. And when bacteria grows, it starts producing the toxin. That's how the disease develops. Actually, human to human transmission is not possible because we don't harbor any bacteria, and bacteria is not capable of transmitting the disease. So unless the spores or the bacteria get into the body through some injury, tetanus will not develop. So we need not hesitate to treat patient with tetanus. We can go and treat him without any fear.
So, doctor, what could be the possible symptoms or complications of tetanus?
Tetanus usually, I told you the incubation period. First,
Yes.
you must know the from the time of exposure to the time of first symptom. This we call incubation period. Typically, incubation period is around 1 to 2 weeks. What happens is, during this first week, the spores should get converted into bacteria. That bacteria should reproduce, propagate, and the number should increase, then start invading the tissue. All these things will take about 1 week's time. And then the first symptom will start. Usually, initially, some prodromal symptoms we call, like malaise, maybe mild fever, like that it starts. And you may find minor twitches which are specific for this tetanus, twitches on the face. If you tap like that, they will get twitching, some spasms will be there. These are mild initially, and those are the only symptoms. And from there, it starts progressing and it will start producing spasms of the muscles. These spasms will be quite painful. If the neck muscles are involved, you may get neck pain, back pain, pain in the lower limb, upper limb, everywhere. All these symptoms will start. The other thing is the typical faces we call rhizus sardonicus. It's a name given to that typical faces because of spasm. It looks like the teeth will be exposed. It looks like patient is smiling with pain. That we call rhizus sardonicus. That's one feature. When the extensor muscles are involved, like back, erector spinae, neck, all those muscles will contract simultaneously and forcefully. So arching of the whole body will occur. It will be in extension that we call opisthotonus. That is a typical position. Once you see opisthotonus, it is definitely a case of tetanus. No other condition will produce that typical picture. The other manifestations are because this is involving the nerves. It can involve skeletal muscles. So these are the features. It can involve even autonomic nervous system also. There we may get irregular cardiac beats. Even heart is involved. You may get tachycardia, means rapid heart rate, or bradycardia, means very slow heart rate. Irregular bp will shoot up sometimes and decrease sometimes, so we call cardiac instability. So such features are possible. When it involves the skin, you get excessive sweating. That is possible. That is because of the sympathetic overtone. And when it stimulates the trachea, it produces a lot of secretion from the trachea. It's so much so sometimes patient will drown in his own secretion. And coming to GIT, gastrointestinal system, patient may develop diarrhea, and such features are also possible in these things. And the ultimately what happens, these pharyngeal muscles are involved. When it contracts strongly, it causes choking, asphyxia we call. So because of the asphyxia, patient can die, or when it involves the respiratory muscles, patient will not be able to breathe. So that also will produce respiratory failure, and with this, many patients they die. Mortality is quite high, and it should be treated. More than treatment, prevention is more important here.
Okay, doctor. As you mentioned about the symptoms, doctor, many a times we have seen certain adults which forget to take vaccination when they get injured, and some deliberately avoid to take tetanus vaccination, and then symptoms get very severe. So at then that time, then how it is treated at the critical at the stage where it is severe?
Yeah, it is difficult. Actually, ideal thing is to prevent. As soon as you get injury and you think there is a risk of tetanus being developed, we have to give the tetanus toxide. Sometimes, for some reason, sometimes they would have forgotten because it is a very trivial injury, maybe one small thorn prick in the agriculture farm. So the symptoms will start developing. Once the symptoms start developing, it is difficult to treat, but still there is treatment. It is not like rabies. In rabies, once it is diagnosed, death is 100%. There is no chance of survival. But here, tetanus, many patients have survived. The treatment mainly consists of, if you wound is there, we have to do wound debridement. Means the dead tissue, whatever is there in the wound, those things to be excised to prevent further progression of the bacteria and production of further toxins. So to that extent, burden of toxin will be lessened. The second thing is antibiotics. The mainstay of antibiotic is crystalline penicillin. Now, because of invention of so many newer antibiotics, we have forgotten crystalline penicillin. But even today, the crystalline penicillin is the treatment of choice. The dose should be quite high. It's something like 1 lakh units per kg body weight. It goes into some 100 lakh units. So that much of penicillin is required. The another drug is for the anaerobic bacteria. Specifically, we use metronidazole. Metronidazole is given in a dose of 500 mg 6 hourly. So these are the two main antibiotics given for this one. The next is the immunoglobulins. We call anti-tetanus immunoglobulin. Those are two types are there: equine and human. Equine are available comparatively cheaper. Human immunoglobulin is not available, at least in Bhadravati. I have not seen it, and it is quite costly also. The equine is available everywhere. So equine for prevention purpose, dose will be less, something like 3,000 to 5,000 units we give. But when it comes to treatment, the dose will be very high, something like 1 lakh international units. That much of a dose is required because it has to the detox, the neutralize the toxins, the tetanus spasmin, whatever toxin is there, it has to neutralize that. And once the toxin enters the nerve, you cannot do anything for that. So from that point onwards, you have to support the patient. That's all. These drugs will not help there.
Okay.
The toxins, wherever it goes, mainly it affects the muscle nerve junction, neuromuscular junction we call. That junction it acts, and then on the spinal cord, and then on the brain. Here, these are the main area where it acts. So once the toxin enters the nerve tissue, we can't do anything. We have to support. Suppose patient has got a convulsion, we have to give anticonvulsants like diazepam, sometimes phenobarbital, those things. And patient will be agitated, so you give magnesium sulfate. These are given in through intravenous route. Sometimes the morphine also used for severe pain and cardiac instability. For those things, morphine is one of the drugs. So these are things we manage in ICU. It needs intensive care unit with facility for ventilator. Many times, if patient goes into respiratory paralysis, you have to put him on ventilator, ventilate him for weeks together. Sometimes the recovery takes about 4 to 6 weeks. So till then, we should be able to support the patient. Then other supportive treatment also should be given. Like patient, because he cannot take anything orally, you have to give IV fluids, then give nutrition also, total parenteral nutrition. All these things support, everything will be required, and ventilation should be there. Ventilation facility should be there. Only in such centers we can manage these patients, because the most of the time the ultimate cause of death is respiratory failure and asphyxia. So we have to intubate the patient. Once we are thinking of maintaining ventilation artificially for weeks together, we have to go for tracheostomy. So tracheostomy also has to be done. So this is the way we try to manage. Still, mortality is quite high. It may be around 30%. One in three patients they die during this treatment. Some of them they do survive, especially if they have taken partial vaccination, at least one dose they have taken, remaining they have not taken. Such patients, there are chances of survival is there. The other indicator is that the incubation period, longer the incubation period, the chances of survival is better. If it is a localized tetanus, the chances is better compared to generalized tetanus. So these are the way why we try to manage the already established tetanus.
Thank you, doctor. Well, doctor, you also mentioned the term tetanus
Yeah.
toxoid. Doctor, can you please explain more about what is tetanus toxoid to the viewers?
Yeah, the tetanus toxide is derived from the toxin. I told you the tetanus
Yes.
spasmin, that is the toxin produced by these bacteria, which is responsible for all these problems. Basically, in immunity, there is one antigen, antibody. Antigen is the protein which causes the problem. It may be bacteria, it may be virus. Here, it is the toxin, and antibody is the body's response for that antigen. It's a foreign protein. When it enters the body, body will produce the antibodies against it, so that it will neutralize that. Means it is deemed as a enemy. So body's defense mechanism, it tries to neutralize it by killing the antigen. Here it's not really killing, but it will be neutralizing this toxin. So this antibody is produced inside the body. This is naturally what happens. Here, because we know this is the problematic thing, we try to induce body's immunity and produce antibody against this tetanus plasmin. So tetanospasmin is taken from the tissue culture, purified, and then treated with formaldehyde. Formaldehyde will detoxify the toxin part, and that is taken out. That we call tetanus toxide. There are some manufacturing procedure is there, how to deal with it, how to ensure that it is not dangerous for the patient when you inject. So those things will be done. And when you give tetanus toxide to the patient, patient will develop antibodies against this tetanus toxin. So the tetanus toxin, which is produced by the bacilli, that will be neutralized by patients, that is the body's tetanus antibodies, and that's how it gives protection against the tetanus. This is the tetanus toxide. This is the most commonly used. This is active immunization. The other part, what I told you, was the sera,
Yes.
anti-tetanus immunoglobulin. That is passive immunization. That means that is already produced antibodies, ready-made antibodies that is injected into the body, because we don't have time for the body to develop this antigen antibodies. So antigen antibody reaction will produce antibodies. If you have sufficient time, you go for active immunization like tetanus toxide, body will produce, that is the best. But sometimes we don't have that much time because already patient has got clinical manifestation. So you have to give ready-made immunity, that is passive immunity, through immunoglobulins.
Well, thank you, doctor. Well, doctor, in case of the tetanus prone wounds, so how exactly is wound care management done?
Wound care mainly includes the debridement. So, if patient with injury, say road traffic accident or something like that, they come, then we have to see that all the dead tissue are excised. This is important not only from tetanus point of view, even from prevention of the gas gangrene and other types of infection and septicemia. All those point of view, this is the basic surgical concept. Whenever patient comes with grievous injury, we try to debride. Debride means removal of the dead tissue. That is done meticulously, and wound should be washed. This is the general management of the wound. Other first aid treatment, I already told you, have to give antibiotics, then tetanus toxide, all those things. If it is a severe wound, means with high risk of developing tetanus, you have to give tetanus immunoglobulin also. Those type we have to manage the wound.
Well, thank you, doctor. Doctor, also, when we see as per World Health Organization, they say people of all ages can get tetanus. But disease is probably common and serious in newborn babies and their mothers. And
Yes,
in above question, you also have told the word neonatal tetanus and maternal tetanus.
yeah, yes.
So, doctor, can you please explain the audience that what is neonatal tetanus and maternal tetanus, and why is vaccination important in pregnancy?
See, neonatal tetanus, I already told you, the first 2 days baby will be okay, normal. And then the clinical manifestation starts from anywhere between third day to 28th day. So this we call neonatal period is up to 28 days, 4 weeks. So within this period, 2 days after the birth. So this period, if baby develops tetanus, that we call neonatal tetanus. Usually, the cause is the unhygienic handling of the umbilical cord. For our age-old people, no, they while ligating the umbilical cord and separating, they put cow dung or some herbal something, they paste it on the cut umbilical edge. This is very unhygienic, this should not be done. This is the cause. And because the baby doesn't have immunity against the tetanus, they will develop very rapidly. Within 2 or 3 days the manifestation will start, and the mortality rate for neonatal tetanus is quite high. The only way to prevent is, of course, the hygienic practices. In surgical operation theater, we go in very aseptic precaution. We put an umbilical clamp and cut it, and that is covered with antiseptic solutions. Or even if we leave it, also it is okay, but it should be done in a sterile technique. That is important. The other thing what we can rely upon is the antibodies. The antibodies baby will get through the mother. So if mother is immunized against tetanus, the baby will get passive immunization, passive protection from the, it is derived from the mother. How to induce this? We have to give tetanus toxide to the mother. The other term is the maternal tetanus. Maternal tetanus is tetanus occurring in pregnant lady during pregnancy or up to 6 weeks after end of pregnancy. End of pregnancy may be normal delivery, cesarean, abortion, whatever. So at the end of pregnancy, up to 6 weeks after the end of pregnancy also is considered as maternal tetanus.
Okay.
To prevent both these, it is the same procedure. You have to give tetanus toxide to all pregnant women, irrespective of whether they have already taken or not taken. Forget it. Give 2 doses of tetanus toxoid. One first dose should be given as early as possible. Whenever you get an opportunity, you give it, and the second dose is given about 4 to 6 weeks later. So definitely should have been given 6 weeks prior to the expected date of delivery. Then only the mother will develop antibodies, and that antibody will go to the baby, and baby is protected. If you give the last dose only 2 or 3 days before the delivery, the baby may not be protected. So this way we can prevent the neonatal tetanus, as well as the maternal tetanus also will be prevented to some extent. This has reduced the infant mortality rate, which when we used to study during our MBBS days, it was around 130 per thousand. Now it has come down less than, I think, 40 to 50, it must be, or even less now. I don't have the recent figures. It is drastically reduced. It's mainly because of prevention of this neonatal tetanus.
That means vaccination during pregnancy is also very important.
Very important. Definitely, it is worth it and very useful in preventing the neonatal deaths.
Well, doctor, is there any vaccination schedule for adults who have never been vaccinated?
Yes, whenever you get the first opportunity. So here in our clinical practice, what we do, whenever we get a patient, even with minor, we say a small pinprick, they say sometimes only one scratch, whatever it is, we get an opportunity to educate the patient and give the vaccination. If he is not at all vaccinated till now, the dose should be 3 doses. We call 0, 1, 6, means the day you give first day, that we consider 0. From there, 1 month later and 6 months later. So 3 doses if you give, patient is fully vaccinated, and this gives protection for about 10 years. So if patient is not exposed to tetanus, you give booster dose after 10 years, and every 10 years you repeat it. This carries the immunity throughout the life. Suppose patient got some injury within about 5 years later. Within 5 years, you need not immunize also again. If he comes between 5 to 10 years, at that time with some injury, we give one booster dose at that time only. So there only one dose is enough if you give like that. But if patient is not previously immunized, you have to give minimum 3 doses. 0, 1, 6. This is the schedule we use.
Okay. So, but doctor, why to the adults who have never been immunized? So, to them, why we say that immunization schedule is very important?
See, prevention of the tetanus toxoid or this immunization, this is the only way. Tetanus spores are ubiquitous. It is there everywhere in the environment. Even in your house also is there. It is in the mouth. It is in the our intestines, gut, everywhere. So it is impossible to eradicate the tetanus spores. So the only way is you protect yourself. How to protect ourselves is through the immunization. Immunization properly should be given in the recommended schedule, because if you don't give according to that schedule, you will not develop good antibodies, and that immunity, whatever developed, it is unreliable. So we have to follow the schedule properly, and usually it takes about 2 weeks for the antibody to be produced in the body. So most of the vaccinations we recommend start as early as possible, stick on to the schedule, give it the whatever recommended in time interval, and after 2 weeks the protection will start developing. But the problem is active immunity gradually fades. Maybe it will take sometimes years together, depending on different types of disease. Here it takes about 5 to 10 years. Gradually the immunity will fade. So in order to stimulate the immunity, you have to give one booster dose. If it is a fully vaccinated person, give it every 10 years, and that will maintain the immunity throughout the life.
Okay. Thank you so much, doctor. Thank you once again for giving us a lot of information on today's topic, doctor.
Yeah, thank
Um,
you.
so, it is time to take questions from our viewers.
Yes.
So, first question is from Mr. Manikanta. He's asking, "Good evening, doctor. I have got a by hitting a stone on my toe in the beach. I did not took any tetanus toxoid injection. Am I safe or not? Bleeding was there. I had cleaned it with antiseptic."
No, antiseptics they prevent only infection. If you take antibiotic, it can prevent infection, but not tetanus. To prevent tetanus, you have to take tetanus toxide. Are you safe or not? It depends on your previous immunization status. If you have completed the three doses, whatever I told, 0, 1, 6. If you have completed this scheduled immunization within 5 years, you are safe. Between 5 to 10 years, there is risk. If it is more than 10 years, definitely risk is there. So you have to take tetanus toxide.
Okay. Then Mr. Manikanta has to take the tetanus toxoid injection.
Yes.
Another question is from Ms. Payal Hota. Is booster dose necessary for adults?
Yes, booster dose. I already told you
Yes.
this active immunity because of the tetanus toxide. They usually gradually fades. It takes long time, not very quickly. It takes about 5 to 10 years. So, if you have crossed 10 years, you have to take booster dose. If you have crossed 5 years and exposed to the spores like some trauma or injury, again you have to take the booster dose. And for pregnant lady, we always advise you take two doses.
Okay. Thank you. Thank you so much, doctor. Well, this is it from the audience. Well, thank you so much, doctor. It was a very wonderful session. We wholeheartedly thank you, doctor, on behalf of my team as well as the Human Biological Institute for sparing your most valuable time with us.
Thank you. I thank all the audience and human biologicals for giving me this opportunity to interact with you all. And it was really some learning session for me also. So I had to go to some websites and refresh my memory and get latest updates, whatever happening in the field of tetanus research. And it was a good opportunity for me to relearn. Thank you, ma'am.
Thank you so much, doctor. And I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. Well,
Thank you.
thank you, sir. Thank you, doctor. You can all follow us on Instagram, Facebook, LinkedIn, and Twitter to get more updates on live talk with expert doctors across the nation. With that, I wish everyone a good evening. Till then, let us prevent tetanus with ease. Thank you, doctor. Thank you.
Thank you. The take home message is you should get vaccinated with tetanus toxide. It is easily available, quite cheap also. Only thing you should be following the schedule properly. That's the most important thing.
Yes, doctor. Thank you. Thank
Now, somebody is asking
yes,
one more question propped up, I think. If rat bite after TT injection
yes.
sufficient or not? Uh, After TT injection means after completion of the schedule. I mean, if you have this same thing, it happens. The concept is same. Whatever injury, whether it is by rat bite or any other animal bite, or even with trauma, any prick, the same thing will hold good. If you are already taken the three doses, 0, 1, 6, then you need not repeat tetanus. If you are not taken, then please repeat it. If you are between 5 to 10 years, one booster dose is enough. If it is more than 10 years, then you have to probably repeat the whole thing. It is better to take tetanus toxide because it is so simple to prevent it, very, very difficult to treat it. And even it can end up with mortality also. Tetanus can be fatal.
Thank you, sir, for answering the question for Mr. Vivek Singh. Thank you so much.
Thank you.
Thank you, doctor. With that, wishing everyone a good afternoon. Thank you.